What is the prevalence of patellofemoral pain syndrome? Well, it's common. It's actually the most common knee condition treated in all outpatient clinics. And as a physical therapist, I can say, yeah, I think that's true, right? Patellofemoral pain syndrome consists of 25% of all knee disorders in the orthopedic setting. So, again, that's going to be more common than any other knee problem, right? And it's very common as an orthopedic issue if you compare it to all types of pain problems, right? It's very common in runners, tennis, and military. 3.8% of males and 6.5% of females get it annually, which is a huge chunk of human beings, right? And it's seen more commonly in young adults and also occurs during periods of rapid growth. So typically you see this in adolescence. What is the clinical presentation of patellofemoral pain? Well, it occurs mainly in young adults, like I said, especially during periods of rapid growth. It usually presents as a gradual onset of anterior knee pain. So, what's important about this is that it is a gradual onset. So, when we're talking about differential diagnosis, if something came up slowly over the course of time, it's less likely to be, let's say, a traumatic meniscus tear, right, or a ligamentous injury, and more likely to be patellofemoral pain. Pain is usually present around or underneath the kneecap. It is a recalcitrant condition that can persist for many years without intervention. In other words, this condition tends not to get better with rest and can stay painful for long periods of time. More on this later. It generally hurts with movements that increase stress in the patellofemoral joint. No brainer, right? So things like squatting, stair climbing, hiking, running, and prolonged sitting can aggravate patellofemoral pain. 75% of patients with patellofemoral pain syndrome present with tenderness along the patella. So if you poke around the kneecap on the outside of the kneecap, you're probably going to find a little irritation in these folks. You have tenderness on the facet palpation, and sometimes you'll see some small joint effusion, although there really isn't much. Okay, usually joint effusion is a sign of more tibiofemoral joint pathology, like a meniscus injury or a cartilage injury, not necessarily patellofemoral pain. There's often pain on sitting or rising from a seated position. Also, some pain straightening the knee following sitting. So, if I've been sitting for a long period of time and then I straighten out my knee, oh, it's a little irritated in that area. Okay. What is the natural history of patellofemoral pain syndrome? So, patellofemoral pain is very interesting to me because it tends not to be self limiting. And what this means is that in a lot of conditions, so radicular low back pain is a good example. So if you have some sort of nerve injury, nerve root injury in the spine, if you do nothing, right, over the course of time, it tends to get better. And they describe this as a self-limiting condition. So basically, because the area is painful, you probably don't do too much to aggravate it. So the body is naturally protecting you from doing too much by providing pain. This allows the area to heal over the course of time, right? This isn't really the case with patellofemoral pain for some reason, right? So after the initial insult, so after you develop knee pain, this pain can be prolonged indefinitely if not intervened upon, right? So it never resolves. Oftentimes in physical therapy, we talk about some sort of pathology regressing to the mean. So over the course of time, your knee pain just gets better because of time, right? Not always the case with patellofemoral pain, right? So a common story I hear from folks that have patellofemoral pain is that they believe they have like a bum knee, right? So basically they hurt their knee at one point and it just never went away. So their knee is just bad at this point, which obviously isn't true. We can intervene and we can actually make this better. But here's the other piece. It tends to be pretty tough to treat. That's that term recalcitrant. So with exercise therapy, so some sort of physical therapy, around 60% of people, and this goes for adolescents and adults, continue to have pain 12 months following the onset of exercise therapy. Okay. And that stinks. No one likes to hear that statistic. But basically, if you have someone that has patellofemoral pain and you give them a program to try to get them out of pain that consists of some sort of exercise, over the course of time, a big chunk of those are still going to be painful. So that kind of stinks. It's challenging to treat, we'll say. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons. Going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain-free mini course. Definitely check this out.